Thank you, Mr. Speaker. Today I rise because families in Ohio's 13th Congressional District and across the country are already paying the price for Republicans' inaction on health care. The enhanced ACA premium tax credits expired December 31st, 2025. And now health coverage is more expensive and families are already feeling the impact. In my district, 90% of the 32,000 people who get ACA coverage relied on those subsidies. 4 out of 5 were previously able to find plans for $10 or less per month. That safety net is now gone. Families are seeing premiums jump by hundreds of dollars a month or thousands of dollars a year. And across the country, more than 4 million Americans have already lost or at risk of losing their health care coverage entirely. This isn't a theory. It is happening right now. In Canton, AltCare, a regional insurer tied to Altman Hospital, stopped offering some individual family and small business ACA plans before December 31st. That affects 6,000 people in my district. These are working families and small businesses, employees losing coverage because Republicans refuse to act. I fought to protect these credits by co-sponsoring legislation to extend them and by signing on to Leader Jeffries' discharge petition to bring the issue to a vote on the House floor. But instead of acting, Speaker Johnson and House Republicans chose to delay, and that action is simply unacceptable. And don't just take my word for it. Just a few weeks ago, Congressman Mike Lawler called Speaker Johnson's refusal to allow a vote idiotic and political malpractice. And I agree. But what happened? Speaker Johnson sent us home for the holidays while American families paid the price. Republicans also pushed a partisan health care bill that would make things much worse by increasing the number of uninsured people, shifting costs onto working families, and weakening the protections that so many Americans relied upon. I offered an amendment to protect working families from losing health coverage and to protect access to reproductive health care. But guess what? Republicans blocked it. So once again, they chose politics over people. We cannot forget the real people caught in the middle of this. Families deciding between health care and groceries, between medicine and rent. Access to health care should be a right, not a gamble. And at a time when we are talking about the horrors and tragic cost of the drug trade and the impact it has on American people, let us not forget, how do people get drug treatment? The Medicaid program that's already been cut by $1 trillion, and ACA marketplace health plans. The Republicans' failure to act is literally going to kill people across this country. They let deadlines pass, premiums rise, and coverage disappear. That is not leadership. That is failure. And so, Mr. Speaker, the choice is clear. Congress can either act to restore affordable health care, or we can continue to let premiums soar, coverage vanish, and families face financial ruin. But I know one thing is for certain, Mr. Speaker. I was brought to Congress to work on behalf of the people of Ohio's 13th Congressional District to lower costs, to keep them safe, and to make sure that they had affordable, accessible health care coverage. Mr. Speaker, I encourage every single member of this chamber to do those things, not only for the people in my district, but for the people all across America who are asking and needing for Congress to act. Thank you, Mr. Speaker. I yield back.